Hi, it's Dr. Charles Benz, and I'm today interviewing somebody for my program, Healing Trends with Dr. Benz. And I'm interviewing him because he's got something called artificial intelligence fine medicine, with fine medicine, fine meaning um, functional, integrated, natural, and environmental medicine. And I'm interviewing him because I met him 3 or 4 years ago when I did an article called Beginning of the End of the War on Medicine. And I was doing a profile of the last 100 years of natural medicine. And I was mentioning some of the people that had been heroes over time, like Linus Pauling and Jeffrey Bland and Joseph Pizzorno. And by the by, somebody read it and contacted him and said, there's this article that mentions you. And anyway, we got together and talked a while, and I found out that he had a new artificial intelligence platform that he was touting for workplace wellness. And of course, that's one of the things I like to do as well. So, a little bit about Dr. Pizzorno is back several years ago, probably when he was just a recent graduate of university, he actually started Bastyr University. And Bastyr is a college of natural medicine and one of the most respected ones, I think, in the country, if not the world. And not too long after that, I think he began to edit the Integrative Medicine, a clinician's journal, which is one of the few really true peer-reviewed journals in the country. And he also wrote a book. I don't know how many millions of copies it sold now, 3 or 4 or 5 million, called Encyclopedia of Natural Medicine with his friend Michael Murray. And other kudos is that he actually has done work with integrative medicine with two presidents, one a Republican, one a Democrat. So he doesn't know any political preferences. And he's just an outstanding person who has done a lot of work, not only as a practitioner, but as a really first class researcher and an author and a speaker. So uh, today I'm going to try to get him to give us a little bit of an insight into how he developed this artificial intelligence platform. And so my first question is, Dr. Pizzorno, welcome to the show. And what was the genesis of this thing you're calling AI, fine AI?
Well, first off, thank you for that very, very kind introduction. That was really nice to hear. So, as you noted, I've been involved in this field for quite a long time. Sorry. I mean, literally, I've been involved in medicine now for over half a century. And I started out as a researcher in conventional medicine, and then I learned about natural medicine and just got so curious about what this was about and how it could help people. And as I looked at this, there were several characteristics that made it so special in my mind. Number one was it treated unique individuals, not generic individuals. When you look at the drug studies, they're all about generic results. And that's okay if you're an average person. But for unique people, for us, each individual person, sometimes the drugs would work, sometimes they'd be toxic, sometimes they wouldn't work. And one of the key differentiations about whether they would work or not was the unique biochemistry of the person. So I started looking then well, why are people sick? And nutritional deficiencies were a really big issue. Then I started looking at, well, but there's not only nutritional deficiencies, but in the last 50 years, we've saturated our environment with metals and chemicals, and those things are poisoning people's bodies. Then we had the genetics revolution. We started realizing, well, we can actually start looking at people's genetics and determine what nutrients do they especially need? What toxins are they really susceptible to? Okay, so you start gathering all this information that's needed to understand the needs of each unique person. It ends up being really complex. There are 100 vitamins and minerals and other molecules in food that are known to be important for human health, and some people could say it's over 200. Then there's 100 metals and chemicals in the environment at such high levels they're causing disease. Then we're looking at the genetics, and there are about 2 million what are called single nucleotide polymorphisms that change the efficiency of how well our enzymes are working. And we put it all together. It's very complex. So that's how we help people do this. Yeah, I've written a bunch of books, but you got to read the whole book and you have to understand everything. And You have to figure out how to apply it. And I became curious about what conventional medicine was doing in using artificial intelligence to help both with diagnosis as well as with treatment. So then I started looking at, okay, well, can we apply that kind of artificial intelligence to this more natural approach? And it turns out it works really, really well. Because in so many ways, artificial intelligence in conventional medicine was to diagnose disease. Now, disease is a concept. And sometimes it's a reality, but most likely it's a concept. So you have diabetes. Well, diabetes means you're not regulating your blood sugar properly. Why is that? Could it be you can't produce enough insulin? Could it be you have insulin resistance? Could it be that there's a problem with the cell signaling? So there's lots of reasons why you have diabetes. So diagnosing diabetes, pretty easy to do. Diagnosing the cause of diabetes, way more difficult. It's easy to give people metformin or give them insulin, depending on where they're at. But trying to cure why they have the diabetes ends up being very complex. So then I realized, well, wow, we can use artificial intelligence to provide tools, not just for doctors, but for consumers as well, to help them understand why they uniquely are having health problems and what are the best options they can use to restore their health. So I got into developing this artificial intelligence system now, and it's very sophisticated. It takes everything we know about a person, puts it all together, and out comes understanding of why a person's body's not working right and what to do about it. Long answer,
Doesn't
sorry,
this
but it kind of laid the whole
doesn't
thing
that
out.
sort of go back to the whole thing that you challenge in your presentations, the difference between allopathic medicine and functional medicine? One treats the symptom, the other one treats the whole body. And you can look at diabetes, like you just said, and see what the things are that need to be treated there. But what if there's 3 or 4 or 5 underlying things that are contributing to that aren't being treated in traditional medicine? Now you're getting a chance to look at the whole body and really see what the underlying issues are. Isn't that part of what the AI does too?
Absolutely. If you read the people who founded the naturopathic profession 100 years ago, they said if you treat acute disease with symptomatic treatment, you'll get short-term relief and long-term more chronic disease. Now, they were ridiculed by the MDs, of course, but
Hmm.
now they've been proven to be exactly correct. We suffer the highest burden of chronic disease in every age group ever in human history. So on one hand, the drugs work great for relieving symptoms. If you look at the 10 most commonly prescribed drugs, you can go on the internet, anybody can do this. Look at those 10 drugs. What are the most commonly prescribed? Not the most expensive, what's most commonly prescribed? 9 of the 10 only relieve symptoms. So if the primary intervention is relieving symptoms rather than treating the cause, you get more disease because the causes continue and the disease gets worse and worse. People have to use more and more drugs to alleviate the problems, and the drugs eventually fail.
Doesn't this go back to one of the core things that I think that you and I and others have repeated over the years, is that 80% of chronic disease is actually preventable and in many cases reversible. And so if you go back to the whole idea that there's a cost involved, and now we know that the existing system is not really sustainable and it's going to bankrupt us, isn't this one of the things that motivated you too, to try to get this under control so that we could capture the advantages of prevention, which allopathic medicine just cannot do?
So, very good insight. And matter of fact, I want to compliment you back after the very nice things you said about me, and that is, you've done such great writing and such good educational programs for corporate wellness people. I mean, you're a great resource. So, thank you. I
Thank you,
really
Jim.
enjoy our collaboration. So, it's almost like we have to keep on saying the same things over and over again, and that is, our bodies are biochemical machines. Our genetics determine how well we make those enzymes, but the enzymes don't work if the cofactors aren't there for the enzymes. Cofactors are vitamins and minerals. But also, the way many of these toxins, these metals and chemicals in the environment work is by poisoning those enzyme systems. So in so many ways, and I'm going to quote my good friend Dr. Sid Baker, a medical doctor in the East Coast, he said all medicine is really quite simple. Get into each person what they uniquely need and get out of each person what they uniquely do not need. So some people, they need a lot more vitamin D or a lot more vitamin C or a lot more zinc than other people. Or they may need activated forms of the vitamins because their genetics don't let them convert the form in the food into the form that works in the body. And then other people, Then you look at the environmental toxins they're exposed to. Some people, yep, they throw them away, no problem, get it out of the body. Other people, those toxins get in there and they cause damage, and they keep on causing damage to get the toxins out. So that's why I think artificial intelligence is so useful, because we can identify for each person what they uniquely need to get into the body, what they uniquely need to get out of the body.
I think that one of the things that I read that you had mentioned about this AI platform was that there are over 5,000 enzymes being assessed and over 5,000 other biomarkers being assessed. So all these enzymes and these biomarkers are the things that actually are making the cells perform the way they're supposed to perform. And if those things aren't working properly, they're kind of giving a signal to the body that something's gone astray or awry and it needs to be adjusted. Is that not something that the AI platform can do? Is say, okay, we can see these are the early stages of development before they become a disease. Then we can prevent them a lot more easily. If you once you get the disease, it isn't a lot more difficult to treat it then?
Very well said. So people think about symptoms as something's uncomfortable, you want to get rid of it. Wait a minute. Symptoms are the body telling you something's not working right. So why you turn off the messages with the drugs? Makes no sense. Now, I'm not saying people should be in pain all the time. Of course, you want to relieve pain. But if
Right.
all you do is relieving discomfort and pain without dealing with why it's there, you're not going to get very far. Okay. So that's what this is about, is using that information before overt disease has developed. And that way, it's much easier to change the body. You can look at, we have normal physiology here, and over here, we got pathology, advanced disease. But in between, we have what might be called pathophysiology, where the body's not broken. It's not working quite as well as it should, but it's not actually broken. Much easier to get things back in balance and go back to healthy physiology. Once you've got a lot of cellular damage, a lot of advanced pathology, yes, we can move people back to better health, but it's way harder. And sometimes things can advance so far that, well, it's kind of beyond the point where the body can fix it. So don't wait till it's way, way down the road and things are really serious. Let's get in a little earlier and fix it when it's easier for the body to repair itself.
So that's one of the things that I've been telling people when I promote the artificial intelligence platform. I say, look, when you get the diagnosis, now you're scared. You know, somebody's told you you have Alzheimer's or you have cancer or you have arthritis. So that sort of gets people's attention. Does it work just as well if you say to them, if you keep going the way you're going, in 4 to 5 years, there's an 84% chance you will get diabetes? Is it not presenting that kind of information that we're hoping to get people to say, aha, that's almost like a diagnosis, but boy, I'm lucky I got it earlier. So isn't
Well
that
said.
one of the things that you were also hoping for?
Well said. So one of the things we do is after we gather information about the person, we say, well, for these 12 major diseases, here's your risk right now. Do you want that risk to go up to full manifestation of the disease, or do you want to start decreasing that risk? The good news is that there's so much we can do to decrease that risk. And it's not just me theorizing, me being a crazy naturopath saying, oh, the body can heal itself. It's research. If you look at our system right now, we have about 15,000 logic elements in the system and 40,000 research citations from the peer-reviewed literature showing that these things work. So we're not guessing. We're not hypothesizing. We're saying here is real research that shows if this set of symptoms presents, if the set of physiological dysfunctions present, getting these key nutrients in or getting these key toxins out, things work better.
And then isn't it the case that you can actually track the progress so that if a person gets a certain score, and that's one of the things that's great about your system, one of the versions of it has a score of 0 to 1,000, and the other one has a score of 0 to 100. But once you get that score and you see what those 10 systems, their score is on each of those, and they're all color coded to indicate whether you're healthy or not healthy in those
Mm-hmm.
particular systems. And you may want to tell people what those 10 systems are. But then after a year or even less, you can track these things as you go along. You refill out the questionnaire because there's a health risk assessment, which I think is like 50 questions. And then there's drop down questions depending on how they answer those questions, which gets a little
Right.
bit more deeper. And then there's blood tests. And then there's the genetic tests. And then there's those 40,000 trials. So you're getting all this information, probably millions of calculations, and all of a sudden you're getting this number. And after 6 months or a year, you put the information back in again, you can see your actual improvement system by system and overall. Isn't that also one of the advantages? People see a picture of what's happening to their health.
Well said. So we had one corporation of 10,000 employees with multiple sites use our technology for 5 years. And so we start out and we gave everybody did the assessment. We have their health score. Then we track the health score for the company over that period of time in total, but then for each individual in the system over time as well. And what we found was that when you give people personalized health guidance, they're much more likely to follow your guidance because it just resonates with them. And when they do that, we then track what happens to their health score. So the average person, unfortunately, their health score goes down 1% per year. Okay, so you say if you live 100 years, by the time you get to year 100, you got 1% of body function left, and you die at that point. Okay, so over this period of time, the average person using our technology, the health score, rather than going down 1% per year, went up a total of 8%. So it had a net total of in the double digits of health improvement. And what's really cool is then we use like Framingham. There's a huge database that predicts people probability of getting, cardiovascular disease and things like that. So we then track the risk for cancer, heart disease, diabetes, all these things, and we can show based on standard criteria for disease risk goes down. And in this particular group, we cut the high risk group in half. We cut the medium risk group by about 25%, and we double the people in the lowest risk. So it works. Now, it takes time. It's not like you're popping a pill. You have to kind of not only get the nutrients you need, you have to eat better and get exercise and sleep, and all those kinds of things are important. But when you tell people, yeah, this is the one that's most important for you, and we try to give people only three most important things. They want to do more things, they can always check on it. Say, here's the three most important things for you to do. And by the way, and here's the things you're already doing that are really good for you. Keep on doing them. So we identify them. So people get a sense of control over their health. So rather than feeling like they're a victim of disease, remember, only about 15% of disease is genetic. Everything else is diet and environment and lifestyle. So when you start giving people the information they need, they start feeling a better sense of control over their health, and they're more willing to make those changes.
So I think you and I both know that there are people that are geared to moving in this direction and other people who need a lot of help and assistance. That would be a majority of people, I think. And so doesn't it help for them to be in a culture of wellness if they're in an organization or working with a doctor that's going to be cooperative? Because if they don't have the right doctor and they share this information and ask really brilliant questions, they're not really going to get the right answers. So having the right doctor and having an organization that is supportive, I would say those would be a couple of things that would be pretty important. What's your take on that?
Oh, 100% agreement. If you kind of look at the ideal situation, we would have in the corporate wellness environment use of our tools, health coaches readily available for people who want, okay, I'm ready to take better care of myself. Help me do that. Okay, I know what I need to do, so help me do it better. And then doctors who appreciate the importance of promoting health rather than simply treating disease, getting this information and continue to help the patient understand how to apply it and how to be healthier. And if a person does, here's another factor, you're going to love this. We don't make a big deal of it, but it's one of those modules I'm thinking of developing. We did a lot of work looking at drugs and how they interact with nutrition. It turns out many of the adverse effects of drugs are due to nutrient abnormalities they induce. So we help people, if they're having to take the drugs, how to decrease the toxicity of the drugs by making sure they have enough of the nutrient that's being blocked or for whatever reason by the particular drug. The point I'm trying to make here is the more we integrate together all this information, the more effective people can be in determining what they should do to help improve their health. But their doctors as well are now going to have much better guidance on what to do about this. What does that person really need? How can I facilitate that rather than simply give them another drug?
I kind of tell people sometimes it's like having 5,000 doctors listening in on your conversation with your doctor. And so instead of just having that one doctor, and you and I have actually done this in demonstrations before when the doctor tried to get his staff to respond as quick as our program did, and he was completely failed. He just said, I can't even get 1/10 of what you guys got in a couple of minutes. So I tell people it's like having 5,000 specialists available, and they're listening, they're watching your information come in, they're listening to your doctor talk about it, they're asking the patient's asking better questions, and all those 5,000 doctors are there consulting with him, saying, okay, this is what you need to do next. And sure, the doctor might make some individual changes based on what he or she knows about that person, but having that kind of guidance, is that going to intimidate doctors? Is that going to empower them? What's your experience, and what can we do to get these doctors to be ready, really prepared to do this better?
Very insightful question. So when I first developed this technology, I actually went to doctors directly. I said, hey, doctor's got this great decision support tool for you, help you understand your patients better. And at that point, doctors were threatened by it. I was really surprised. So I realized, okay, I have to go a little different direction. So then I started getting involved in providing this for corporate wellness. Lot of interest right there. And I think the world has changed now. I think doctors are much more willing to use what are called decision support tools. And so I think that we will now see a lot more acceptance. But when I first did this, like 15 years ago, it was hard to get doctors to pay attention. Good news is now they're realizing they've got to know this
Yeah,
material.
but there's still quite a gap between where they are in terms of their knowledge of functional medicine, and they're kind of stuck in the systems that they have. I find it really hard to find doctors that are totally on board and ready to jump into something new. They need to learn more about it, and yet they're pressed for time. Do you think we have to develop some learning tools for them that are going to help them to kind of be able to ramp up and get ready to do this? And so, what do you think about a program like this, where we would have some modules where the doctors can kind of learn as they go how to use the system and how to benefit from it? What do we need in the future in order to make this thing work even better than it has so far?
Great idea, Charles. 100% support. And so you recall that while we set this up, and we can turn on or turn off this feature. We don't tend to turn it on for consumers because it's too technical. But I put it in there for the doctors. So when we make a recommendation, the doctor can actually click on that recommendation and then dive down into the biochemistry that show them why we made that recommendation. So it's a very powerful learning tool for the doctors. So when I said we had trouble with success with doctors early on, we had half a dozen doctors who loved the program and used it and said exactly what was happening is they're learning all this biochemistry that was directly relevant for their patients. So again, I think doctors are more receptive to this now, and we definitely need to work on this.
Yeah. How about case studies? I mean, one of the things that I'm always curious about is we know what the 5 or 10 most significant illnesses are. Do you think there would be any benefit to having some case study examples where either groups or individuals use the AI platform, that they and the doctor got some things sorted out that they hadn't gotten sorted out before, and they got some really great results? Because I think the statistics you have from that client with the 9,000 employees is good, but don't you think that might be strengthened a bit if you could actually personalize it and have some individuals and doctors saying what they're able to have, what they were able to do with it?
Yes, please.
It's an easy one, right?
It's one of my challenges is that we're so far out of the kind of the medical industrial complex that the funds needed for this are really limited. So I've funded most of the development of this technology, and it's been a lot of work. And that's an example of kind of things where we need to do more of that, and we need the resources for doing it. So right
Right.
now we've got a really
And
useful tool and need to do more research.
okay, well, I think that money is going to come when we get closer to having the kinds of things that you and I have been talking about. One of the things I did want to mention was that you have such a high participation rate. I think your group had an 85% participation rate. Most insurance companies and brokers are lucky if they get a 12 or 15% participation rate for any of the web programs that they offer. How did you get them to do that? Was that the coaches that company employed to try to get people to pay more attention? What were some of the things that were done then, and what do you think should be done now to make sure we get people involved and keep them involved?
Yes. Yeah, you're referring to something that's pretty significant, and that is one of the challenges with conventional corporate wellness programs is the ones who sign up tend to be people who are already committed to health. Okay, and they're not the ones you need that are costing all the money. There's only about 20% of people are over a 3-year period of time responsible for about 75% of healthcare costs. So how do you get to them? So the way that this company did, which was very clever, is they said, well, we have 2 insurance programs available for you. One's kind of crummy and expensive. The other one's better quality and cheaper. And in order to use a better quality, cheaper one, you've got to use this artificial intelligence system to improve your health. So everybody said, well, okay, if I got to do this, I'll do this to save some money. So I did it, and oh, wow, that was useful. I'm going to do what's recommended here. And we got all these great improvements with dramatic decrease in the, remember I said, the people in the highest risk group decreased by 50% over the 5-year period of time of this.
Right.
They're the ones who are cause all the healthcare costs. So huge benefits.
Right. So the incentives are really key. It sounds to me like if we could
Incentives.
get to a point where, and I don't know whether it's legal to do this or not, but I've been floating these ideas around, trying to get companies to say, look, if your people get this score, they keep their insurance the same. But if they get a lower score, they have to pay a little bit more. And if they get the score back up again, they get the benefits. Is there any way that you think we're ever going to be able to get the laws and the systems organized so that these incentives are actually legal and we don't get challenged in the court all the time?
Great observation, because as you well know, there are a bunch of federal laws that would not allow that to happen. Okay, because it discriminates against sick people. Well, I agree, should not discriminate against sick people. But the person who's smoking, should I have to be subsidizing their healthcare costs because they are consciously choosing to do something that's hurting their body? Okay, so yes, we need to get to the point where people directly benefit from improving their health. So another small company I worked with, it was an insurance broker with 10 companies that they're providing services to, and they were pretty interesting because they were an integrated health insurance, but also wellness programs. So they set it up so that as the company's health improved, everybody got kickbacks. Okay. And so they started engaging in being healthier, and we got great statistics with this group. Their health costs went way down, and people were getting healthier. The owners were happy because they're more productive, and they're also happy because their healthcare costs were going down. So during this period of time, this is a few years ago, healthcare costs were going up double digits every year. In this group, the healthcare costs were at the rate of inflation. So they basically, over a period of several years, their healthcare costs got way cheaper than everybody else's.
Wow. I think the last thing I'd like to sort of touch on is, you and I have been doing this for about 3 or 4 years now, and we see things come across our desk all the time where some company says, well, they've got an AI platform that does this, and they've got an AI platform that does that. And invariably, when you look at them, one of them has genetics only, the other one has 18 blood tests only. There's lots of limitations. But um, what do you say? Because if it's more convenient and costs less, or somebody thinks it's the same, I mean, when I tell people that we have a wellness program, a lot of the employers say, "Well, yeah, we have a wellness program too," and they think all wellness programs are equal. And we know that's not
Yeah.
true. So how are we going to differentiate your AI platform with the ones that are coming on stream that have a lot of limitations? Do you think that you'll be able to sustain the advantage you have? How are you going to make it better? And how are you going to differentiate yourself from all these things that are coming at us left and right every day?
Yeah, very good point. And I have been concerned about groups that say, well, we'll run these lab tests, we'll tell you everything you need to know, or we'll do your genetic testing, we'll tell you what you need to do to be healthy. It's not that simple. You need to have the genetics, you need nutritional status, you need toxic load, you need to understand what is already not working properly in the body. You need all the information. You can't just look at one piece and say, that'll do it. It doesn't work. Remember, the ones doing the genetics, only 15% of disease is due to genetics. Okay, so
Right.
works fine for that 15%, but the other 85% can give them misleading information from my perspective.
So you get good results from just the health risk assessment because when companies are purchasing this, they purchase just the AI platform with the health risk assessment. But obviously, what you're saying is if you have the blood test and it's a good blood test, you can actually get much better results. The problem is that a lot of people have blood work, but it doesn't have all the right things in it. And so I think that your system has about 600 different markers in it, but I've developed a couple blood tests that I think have a lot of the best markers in it for getting this information, like C-reactive protein and the glycomark test, and you're the one that you have for DNA, which is the 8OHGD test. So getting people to be educated enough to know that you have to spend more than just the AI platform. You have to get some of these blood tests. Then you have to get some coaching. So it's more than just saying, here's the AI platform, let's use it. That's part of the educational process because employers don't want to spend more than a certain amount of money. But if they spend a little bit more, they get a lot more return. I guess that's the last thing I'd like to end on because the group that we're going to be presenting this video to is the group who are going to be either the doctors or the employers who are going to think about doing this. What do you think is going to be the potential benefit if they do it the right way with the right blood tests and the coaching and getting the right doctors? What's the bottom line that you think employers can get over a 5-year period?
Yeah, another great observation. Now, obviously, from my perspective, the more information you give me about a person, the more accurate and, might say, in some way subtle, the guidance we can give people. So if I know what their toxic load status is, if I know what their nutritional status, their bioload environmental toxins, their genetic susceptibilities, if I can get all that data in a relatively objective way, boy, I can really give great information. Now, having said that, if all I have is signs and symptoms and diet and lifestyle and presence of existing disease, sure, I can give people good advice. I can give a lot better advice if I get more information. So that's one of the challenges. Right now, we have 3,000 inputs into our AI. So 500 SNPs, for example, 100 environmental toxins based on not just body load tests, but zip code. If we know where a person is living, we can tell them how much arsenic's in the water. We can tell them how much particulate matter is in their air. So a lot of these toxins, we can actually determine their exposure by their zip code. So, and then in terms of nutritional deficiencies, we start with the assumptions based on this huge database by the USDA, where they looked at, for 50,000 people, they looked at 13 nutrients and they broke it down according to 13 ethnic backgrounds, age, gender, region of the country, things like this. So we can predict where the nutritional deficiencies are. So there are ways we can assess what's going on by kind of comparing people to big databases. But the more specific data we can get from people, the more accurate we can make it. So the big corporation I mentioned to you, the only lab test that they did was vitamin D and cholesterol. Okay, but as you were saying, you've developed a much better protocol for evaluate or laboratory panel for evaluating one of the most important things. So many times, the test the doctors run is to detect disease. Well, we want to get them before they get to disease. Okay, when there's still physiological dysfunction, which means you have to run a totally separate set of tests. So your family doctor may say, well, here's a test you should run. But when you look at them, they don't tell you much about physiology. They just tell you where the body's actually broken. Well, we want to get earlier in the process.
Right. Well, I think that you've helped really clarify a lot of things about how the AI platform can work and how it can be beneficial to individuals, because that's where everything starts, with the individual. I think that your platform is going to be very helpful for people who want to really practice self-care and be partners in their educational process with their doctors and their employer. And I think we're moving in the right direction. And I really want to thank you for the work you've done on the platform and all the other things you've done to help move the needle of natural medicine in the right direction. And it was an honor for me to be able to interview you today and share this information with how you came about with this idea and actually are still developing it and renewing it every day. So Thank you very much for all that you've done, and we really appreciated the opportunity to interview you today, Dr. Pizzorno.
Well, it was an honor for me. Thank you very much, Charles. You do great work, and I'm happy to be supportive of it.